It's a real pleasure to be here today. I really love the LeBron example, Tim. That was fabulous. As Tim mentioned, my name is Ken Goetz, and I have the privilege of running customer success here at Athena Health. I can say with authority that we absolutely obsess over our customers. And as Tim kind of alluded to, one of the things that makes Athena, I think, really special is that every client gets a customer success manager, no matter how large or small you are. And those CSMs work tirelessly to help their customers adopt Athena, optimize Athena, and more importantly, to ensure our customers are getting the return on the investment that they made in our software and services. And in fact, what Tim said about having being bilingual, we have CSMs that used to work in Athena practice, now work in athenaOne. A lot of them are focused on accounts that move from Athena practice to athenaOne. So it's somebody who speaks the language of both the old and the new. And we found that the customers really appreciate that, and it creates a much better experience. So we do have some fantastic guests joining us today for our customer panel. David Swartout is Chief Executive Officer and owner of Mountain View Medical Center. And we also have Kaley Meadows, Practice Administrator at Anderson Hills Pediatrics. And I'd like to start off by thanking you, David and Kaley, for joining us. Before we begin with the questions, I would like to just take a moment to learn more about you and your practices. And let's start with you, David. Could you tell us about your role, your background, and your practice, and how long you've been on athenaOne?
Yeah. Good afternoon, y'all. Yeah. So David Swartout, I am one of the owners and chief executive at Mountain View Medical Center. I've been here at the clinic for 17 years, and I have the privilege to serve a team of 58 staff. We're an independently owned primary care office about 30 miles west of Portland, Oregon, here in the Pacific Northwest, kind of in the foothills of the Coast Range. And we have been on athenaOne since November of 2022.
Fabulous. And David, before we move to Kaley, can you share with us what makes your practice unique?
Yeah, a couple things, I suppose. So we've been in business since 1990. Our founder, Dr. Tim Gray, has two sons that went off to medical school. So they grew up in this small town, went to middle school, high school, went off to medical school, and found their way back. So we actually have a total of 3 Dr. Grays, which is not difficult at all to manage.
Right.
So with all of these doctors, patients will say, "Oh, I'd like to see Dr. Gray." And then as a side note, so Dr. Gray Sr. is 6'4", the oldest son is 6'8", and the youngest son is 6'11". So,
Wow.
all right, which Dr. Gray? Well, the tall one. Yeah, no, that doesn't actually still help. One of the things that makes this unique is we still do home visits. So a few days a week, these docs kind of spend their last appointment of the day, and we go visit those patients that are homebound, and kind of bring a little bit of that old town doctor. So we just saw a little bit of this, right, with the use of an iPad and athenaOne Mobile. We're out visiting patients in their homes.
I love that. That's fabulous. Thank you. And Kaley, please share a bit about yourself, your background, your practice, and how long have you been on athenaOne?
Sure. Hi, I'm Kaley Meadows. I am with Anderson Hills Pediatrics. We are a multi-location private pediatric group. We have pediatricians, dietitians, lactation consultants, and behavioral health therapists as well. So give a little bit of that multidisciplinary approach still in the private pediatric environment. And we were crazy. We decided in the midst of COVID that we had to make a transition, didn't really have a choice. And so we jumped over to Athena officially in April of 2021. So we are right at that 4-year anniversary for us. And it feels like it was just yesterday, to be honest.
That's courageous. And Kaley, what would you say makes your practice unique?
That is a loaded question. I think we really focus on trying to be a family and making our patients also feel like they're part of our family. And so we started in the 1970s, a little bit similar to David, in that we have that succession of the child of the original owner that is now about to be managing physician partner here at this practice. But again, we take a lot of care and want to make sure that our patients have that family focus when they start with our practice, as they graduate from our practice, and then start to bring their children here as well.
Yeah, that's great. All right, wonderful. Well, I'd like to pivot into some of the different areas of interest. And I think first up is the whole decision making and conversion process. And Kaley, I'll start with you. What were the driving forces behind your decision to change systems? How did you go about doing that? And was it a formal process? Did you look at other vendors?
Sure. So I mentioned that was our COVID crazy. About that time, we had a perfect storm brewing outside of everything that was happening with COVID. We had a physician and IT manager who had really done all of the modifications and programming and everything that we needed on our IT system, and also Athena practice. He was retiring. We had servers that were at end of life. And so we wanted to move away from those and into something that was going to be more cloud focused. And we had, as Tim mentioned earlier, just built system on top of system on top of system. And so we were really dealing with the headaches and heartburn of those not always working correctly, or one going down and the other one still functioning, and who managed and handled what. And so as those things started to collide, we put together a work group and committee to determine what potential EMR vendor would make sense for us. Looked at a couple of different proposals, what the platforms look like, similar to what we saw here today on demonstrations, and then ultimately presented that to our partners here at the practice and had unanimous consent, not only from them, but from all of our physicians here, that Athena was the right platform for us to move forward, and started making that transition plan quickly from there.
Yeah, that's excellent. And David, a similar question to you. As a Quattros Healthco customer that was also very involved in Chug, how did you look at making this change?
Yeah, so I'll back up a couple more years before that change. So it was about 2017 or so. We had hired a clinical quality director within the clinic because, you know, up to that point, it was just me. And I was kind of wearing a handful of hats and, doing quality in my free time. And what we noticed as this fundamental shift in fee for service was sort of going away, and we were moving into this, more quality aspect and pay for performance. So as we fast forward into 2021, when we were looking at making this decision, we were a part of CPC Plus and all the different quality initiatives. Kaley had just mentioned it, right? That we were in this area of just tons of human glue, and this idea of trying to keep quality a lid on it. So knowing that if you weren't a top tier quality practice, you were just not going to get the same, the same contracts, the same insurance. So it, again, just so much bandwidth. So we took a hard look at a few different EMRs, and ultimately athenaOne was a clear choice.
That's great. Well, let's talk about a little bit about your partnership with Athena during the process. And I think, Kaley, we'll go to you with this one. Let's talk about that onboarding experience. How did your teams collaborate with you ahead of go live during the, our teams collaborate with you ahead of go live during the onboarding process? What worked well and what didn't work quite so well?
Sure. So I think one of my favorite parts as we were getting started was having a meeting that athenaOne initiated to say, what is your vision? Let's outline that first, and then we'll work on the build from there. And so it really gave us a good grounding point as we moved forward, because there are pieces where Athena practice does not work like athenaOne. You need to be open-minded for things to work well, and maybe reinvent some of the workflows that you've had historically. And so when we think about what worked well and what didn't work well, when we were very honed into this is how we've always done it and we have to, that's where we hit a lot of roadblocks and being able to progress and move forward as, quickly and nimbly as maybe we needed. But as we kept the open mind, that's where it really helped kind of move this process forward. So I think that really set the groundwork for us. I remember weekly meetings, sometimes multiple times a week, with different stakeholders from our practice. So it might be something billing related or clinical related, or scheduling, until we hashed out and had built the system the way that it worked for us within the functionality of athenaOne. One thing that I felt like was very successful in that was allowing our super users to join in on some of those conversations of the build, because, sometimes we know what works best at the 10,000-foot view, but Athena being really open to allowing our super users to join in those calls, I think was helpful too, to make sure we had the best build that worked for our practice. One of my favorite things, and I think was something that was unique, is the onboarding team actually helped us develop patient case scenarios ahead of go live. And we changed some of our calls to be where they let us run through these scenarios ahead of time, kind of in real time, with the main types of patient visits that we see. And so as we hit go live, we knew what some of our roadblocks were potentially going to be, had made modifications ahead of time, and that really made things much smoother when the real patients were in front of us on day one.
Yeah, there's always going to be some sort of functionality that doesn't quite exist in the new EMR, and you sort of touched on this with a couple of the tactics you described, but anything else you would add about how you manage that with your staff and providers?
Sure. I think the intake process, and I can elaborate on that more too as we go on, but the intake process looked very different as what we saw in the demo today, and as we were really evaluating our roles of our medical assistants and what they needed to do. And so again, having those conversations and allowing our super users and medical assistants to be involved in some of those meetings with Athena was really fruitful in making those adjustments that we needed, and what their workflows and the expectations would look like as we moved from one system to the next.
Yeah. And David, a similar question for you. No one really likes change. How do you get the staff behind the project, and what kind of a difference did that make? Any specific lessons learned, or what you would do differently that our audience should keep in mind?
Yeah, for sure. No one likes change, right? But everybody loves improvement. So we really focused on how athenaOne was going to improve their lives. And the leadership, we made a decision early on that we wouldn't talk about, we're going to change this and this and this and this, but hey, how can we rally around this idea of, what's in it for me? How do we improve the workflow that you're doing? And I promise Kaley and I did not compare notes prior to this, but we also involve the staff very early and very often, because something that we found to be true is that if your team can weigh in, then they can buy in. And so we too structured our meetings. We started at 7 a.m. a couple of days a week, and that gave folks the opportunity to come in and be part of the discussion. And we were super open about that. We posted on our intraweb the list of, hey, here's what we're going to be talking about this week. And then as time came up, right, we sort of voluntold folks like, hey, we're building schedule templates this week. You shall come, because please be a part of this, because you're going to have to live with it more so than maybe some of the administrator team is going to. So how do we involve those folks and keep them tied in, right? And I think, if I were to do it again, I really, I think our approach and our structure was really good. When we transitioned from the athenaOne or Athena practice to athenaOne, we didn't actually dip schedules, that we were able to just keep it seamless straight across. But had I need to do it again, I would double down on the communication piece of that. Even though I thought we did a really good job, it seemed like it could never be enough. So I'd focus in on that spot.
They never can have enough communication. Let's pivot a little bit to post live. This is a part that's pretty close to my heart. We're here to support our customers and to work in partnership to help them find their greatest success. And the role of the customer success manager is pretty critical to that achievement. David, question for you. How has your CSM contributed to your practice's success since transitioning to athenaOne? If you could talk a little bit about your cadence calls, monthly calls, and in what ways your CSM is proactive, and what does that mean for you?
Yeah, of course. Right. So this was something new coming from the Athena practice side, this idea of a CSM. So we meet with Carol the third Thursday of every month, 10 a.m. And so this standing meeting is our chance to really get to talk about any concerning metrics. Being in my current role as CEO, I'm not in the day-to-day so much. So I love the data side of the Athena app. And I appreciate getting to see the efficiency aspect from the work we're doing from a high level. Carol, we sit and talk about upcoming releases. It's really, kind of a blessing to know she knows our business well enough, and she calls out certain aspects of, hey, this update's coming, and I know y'all do this and this and this. So, hey, heads up, I think this is going to really affect, your team in a positive way. Something you might want to pay attention to.
Yeah. And Kaley, similarly, can you share specific instances where your CSM has provided support or resources that significantly impacted your ability to operate? And can you tell us just about overall support, the CSC, the success community, and how that has gone for you?
Sure. One of my most favorite things that happens with my CSM is not only do we have our monthly cadence calls, but she's so open to me saying, hey, can we just sit down for an hour or two or more and brainstorm how we can leverage Athena better? So one example is we moved from a third-party platform checking our patients in to allowing Athena self-check-in to happen. And so we were hitting some roadblocks on not understanding how the functionality really had worked. We had contacted the CSC to ask some of the questions and understand a little bit more of the functionality that way, and had learned a little bit, but felt like we really needed an expert who could dive into that with us further. And so she does a great job anytime that we have ideas where we think we can leverage Athena further to really sit down with us and understand our workflows, understand what other pediatric groups are doing, and really help us get to where we want to be. And it's very rare with a lot of different vendors we work for a lot of very different reasons, very rare for us to have somebody that is that dedicated to support us. And then, we also have user group calls. There's a pediatric group that meets monthly. We wanted to initiate card on file as being a requirement for all of our patients. And again, it looks beautiful in how it's demoed, but there were a few nuances to being a pediatric practice that we needed to make sure we understood and had those working properly. Had another group demonstrate that for us in that call, and then also spent time one-on-one with them on the side. And so I think the part that's great about Athena is you have an opportunity for a community that's just so large to leverage if you want to, and an opportunity to constantly look to see how you can grow and improve the system.
Yeah, you touched on a couple of really interesting concepts there, Kaley. One is that our CSMs are not just advocates for the customers that they manage, but they're also coaches for them, right? They're intended to help partner with the customer and coach them on best practices related to Athena. So great to hear about the relationship that you have with them. And you also mentioned all the support you have, and so maybe I'll just stick with that for a second. Both you, Kaley, and David are involved in user groups. We'll start with you, Kaley. Can you tell me a little bit about how that has helped you?
Sure. I think there's times where we think we're the only one with an issue or a challenge, and we're trying to understand how to build a new order set or roll out a new workflow. And so having those user groups gives other practices that are in very similar situations to us to be able to work together to try to accomplish, again, maybe learning new ways to use the system, get past some of the roadblocks or challenges that maybe we think we're experiencing. And again, just kind of learning from one another. And so not only does that open up in, monthly meetings for us to connect and touch base there, but has fostered relationships outside of there as well, where there are other practices where we talk about, patient self-scheduling and how do you get past the patients who schedule wrong every single time and not let that negatively impact the workflow of the practice. Or, we're rolling out this new testing platform and we can't find an order set. It's got to be here. Who can help me? So again, there's just so many resources available to us between the CSC, the CSM, and these user groups that it really helps you feel like your specialty is valued as well.
Yeah, David, same question for you. How have the user groups helped you?
I mean, Kaley said it, right? Kaley and I just met a couple weeks ago through this, and it's when you get to talk to somebody that you haven't met before and instantly you speak the same language and we have the same issues, even though we live in different geographies and see different patients, but being tied together through the CMR and being able to share challenges and wins and successes. Ken, you'd mentioned it. I was a part of Chug for a handful of years, and I volunteered and I sat on the board of directors. because I believe in that power of connectivity and learning from other shared experiences and how we can apply that into our clinic just to improve patient care.
Yeah. So that's fabulous. Now I'd like to maybe switch gears just a bit and share a little bit more about your experiences on athenaOne. And David, we'll stay with you here. Can you provide some specific anecdotes about how the athenaOne mobile app, Athena Communicator, or other tools have improved your workflow compared to what was available with Athena Practice? And that would include some of these AI-powered tools within athenaOne that are designed to help improve the provider and the patient experience.
Yeah, so I'll start with that. So I mentioned it right at the beginning, right? This idea of our use of house calls, right? So with an iPad or laptop and the athenaOne mobile app, our physicians are literally walking into patients' homes, and we have our entire EMR laying right there. And we could have technically, I suppose, pulled this off in the Athena practice model if we log into a remote desktop on our on-prem server and, right? But being able to log into any Google browser and voila, athenaOne app is there, it's definitely streamlined that process for us. You know, I think another advantage for us with the athenaOne mobile app is, you know, our clinic, the exam rooms are pretty spread away from provider offices, and at least our experience has been our providers have, you know, just as Dr. Clark was showing the schedule, they just carry that around on their phone, and they can go from room to room, who's up, okay, what are they here for? And they can take a look just via their phone and not be tied to their desk. And so they actually don't. They actually will pop out of this exam room, who's next, who's behind that door, and then go into that next room. You know, kind of already having some data without having to go back and check in, and we just don't have that ability before. I think on the, if I switch gears over to the communicator side of that, man, our recalls are just, they're just better, right? They're way more streamlined. Athena practice required just a gob of human glue in that space to make sure that we didn't, you know, send out duplicates or we completely missed a whole, you know, panel of patients. You know, now we're able to send recalls via text and phone or email. You can pick all three or pick one, however patients would like to be contacted about that. And then also the ability just to get super granular about that we can actually target patients by insurance. We can target them by care gap. You can kind of pick and choose, right? So if you can't really just, hey, I'll take all physicals for all people all the time, ready to go. It just inundates your entire system and you can't handle that. So being able to measure those out has really been great. And then I think finally you asked about AI. I think that was the last piece of that. Yeah. You know, really I would say for us, probably the biggest win for us was the ability to take a picture of an insurance card and have all of that data find itself into the appropriate boxes. And then, you know, and then even all the insurance eligibility that goes along with all of that piece, right? That was such an uplift for us specifically. And then kind of a really nice to have is that Athena will read inbound documents that we get from specialists and whomever, and sort of like, hey, this is a cardiology consultation report. Let's stick it in this part of the chart. Like all of that, you know, all of that having to pin those down with humans it's just gone. So it's been super great.
Yeah, that level of automation and the added flexibility is invaluable. Kaley, tell us a little about your experience. How have these tools changed the way your staff interacts with patients and manages their daily tasks? And what feedback have you received from your patients regarding the innovative features that we have at athenaOne and how those tools have impacted their satisfaction and engagement?
Sure. I think it's easy to echo David in a lot of what he says because there are so many things there that I'm like, yes, that's for us too. You know, one of the things of working in pediatrics is our parents hate checking in for their appointments, especially when they're bringing 3 to 5 kiddos that are all under the age of 5 and they're having to complete the same forms over and over and over. And so the intake process has been something where we've narrowed down what we need only when we need it, by appointment type, by insurance, by the last time they were at our office, and are able to capture that check-in process really quickly with those parents, so that they don't spend much time doing that before they are then seen by our team. And then the beauty to that, as David had mentioned, is the insurance cards, that information is funneling right in. The pharmacy that they're going to need the prescription sent to for today's visit is already there. So we're eliminating the questions that our team necessarily needs to ask and spend time documenting, and are able to spend more time with that one-on-one care, or even see more patients during the day, to eliminate some of those barriers in care that we would have maybe not had in the past when our schedules were really, really full. And so feedback in those instances have been great. Our patients also love self-scheduling. We have worked a lot on our recall process, creating campaigns that sound like our physicians. They're reaching out to them to say, hey, you are past due or due soon for your checkup. And as David mentioned, that text goes out with a link to schedule, and we get immediate uptick in those patients that are showing up for their appointments and getting those scheduled.
Yeah, that's fabulous. What about reporting? What has been your experience with reporting?
My team will probably tell you I'm a little bit of a data nerd. I love it. I love that there's so much different information that I can get. We can dive into the billing side of things, patient demographics, or what's happening in clinic, and understanding order sets and how they're being completed and what's happening with our patients. So I just love that there's such a breadth of data that I can grab quickly. Reports can be automated to show up in my inbox on a periodic basis. So there are things that I want to see weekly, monthly, daily, and those are already there waiting for me once they've been created, or some of those are already static reports Athena does. So I love that. Our providers have more detail, and we've scrutinized billing behaviors and patterns more than we probably ever have before. It's made it easier to do chart audits and look for places where maybe there would be red flags. One of my most favorite things we're launching now is a time of service dashboard for our front office team to be able to see what percentage of patients are we collecting that card on file agreement for and getting that set up for them, and how often are we collecting those payments that are due from our patients or for the family when they show up for their visit. So just, really making that transparent to our team so they can see how they're doing, and we can celebrate the success and wins of our practice from that perspective. So yeah.
Yeah, that's great. So let's talk next about results on athenaOne. And Kaley, we'll stay with you here. Can you share some examples of how athenaOne has led to measurable improvements in patient care, provider satisfaction, or organizational efficiency?
Sure. A couple key things that can come to mind immediately. Our no-show rates dropped by 50%. So when we talk about those recalls, and they showed them in the demo or talked about it a little bit, those are working and they're effective for our patients. And then not only that, but we've also seen a 30% increase in the patient visits that we're being able to complete. When we made this transition, we did look really heavily at our appointment times and the links associated with those and what our types were, and made some changes there, and definitely have leveraged busier schedules because of that. You think busier schedules, and so maybe does that lead to additional burnout because now we're seeing more patients and we have more to document. But one of my favorite stories is we were recruiting a new physician, and in the middle of an interview, it's often asked, what EMR are you on? So they know what they have to learn, right? And I was shocked. I didn't expect two of my physicians that were there in that interview to immediately chime in and say, we have athenaOne and we love it. You'll love it too. It's super easy to learn, and it's fantastic. And so that was our first interview, and that theme just continued as we move forward. And so it was a really good testament that the decision we had made was the right one for them.
Kaley, you mentioned a couple of data points, the no-show rates and the visits with completion visits. Are there any other data points or metrics that illustrate positive changes you've experienced since adopting athenaOne?
Sure. One that comes to mind recently has been looking at our collection rates on our patient balances at that 6-month window. How effective are we at actually collecting those? We know that more and more high deductible plans are pushing more to our patients and our patient responsibility. And so we've seen significant improvements in that 6-month collection rate. We have it at 86% for our patients paying their portion of the balance. Card on file and having that agreement in place pivoted that really substantially now that we're collecting payments. And so we're also seeing days in AR drop by a few as well, just because we're not waiting on the patient to reach back out to us to pay.
Yeah, that's great. David, when speaking with your director of operations, Tina Kaley, during the previous panel discussion, she told me that the data in athenaOne has a huge impact on your business. It allows you to see all the efficiencies of staff and providers and show them, and it shows you how to improve. Can you tell us more and provide some examples?
Yeah, so we have standing one-on-ones with our provider team, right? And maybe it's just our providers specifically, and we're unique in this space. But if you go up to a provider and you start talking about the ways you want, hey, I'd love you to change workflows, and you don't provide any data, they totally love that. They do not love that. So, really being able to have this dashboard of data to sit and talk about how, number of counters they saw today, how many were, do you close same day, the next day, within 3 days, more than 6 days old? How often are you using encounter accelerators as it compares to their peers? Are you using quick text very often? Are you using, bringing in data from old visits to make sure that you're, bringing forward last year's data? Are you working at the top of your license? And what I mean by that is the dashboard that athenaOne will provide really is, how much time are you spending in prep time versus your medical assistant? How much time are you spending in the intake versus your medical assistant? How much time are you spending during the exam? What's that documentation time? Just this a mass amount of data, right? What really just lets us speak intelligently to the efficiencies that we gain. And Kaley just talked about it, right? The ability to see more patients, but it's way less burdensome.
Yeah, Tina also mentioned that you all really dove into the marketplace. So at a high level, in your view, what is the value of the marketplace for you?
For us, it was really I would say each practice is unique, kind of in their respected spot. And for us, the marketplace, being able to identify gosh, we're really low in this particular space, in this spot. And, I wonder what sort of, what's out there, who could help us with, for us specifically, we had a couple of nurse care managers that went on maternity leave and had a medical emergency and being able to just, what's laying out there. So we were able to go into the marketplace and look at all the potential options there. And then I guess having some confidence knowing that if you're on the marketplace, then you've been vetted, you work with athenaOne, you understand the ins and outs of that. It's not going to be a massive stretch to, gosh, this looks like a really good product, but do you actually speak with the EMR that I'm using? So having that confidence to, shop Amazon, so to speak, of all the different products they're laying out there is super, super helpful.
Yeah. I think maybe one more question before we transition to Q&A, Kaley, for you is, tell us a little bit about burnout. How has the transition to athenaOne helped you address issues of burnout among your staff and providers?
I think going back to that interview experience said a little bit of it all, and that it's an easy system to understand. But, in talking to some of our physicians, the underlying thing that always comes out is I want to spend time talking to patients, spending time providing care. The last thing I want to do is documenting. And so when we went live, we said, let's do what it takes to get to baseline of what is good, to be able to chart the way we need to move to athenaOne and start on a new platform. And then from there, let's not let good be the enemy of great. And so we consistently are looking for ways to automate workflows, leverage the system better. The recall system, knowing that referrals are going out and they're being tracked without the physicians having to worry about it. Our continuity lists are being addressed quickly and in an automated process that's still very personalized for our patients, has allowed our nursing team to have some time that's freed up to support them. So it's thinking outside of the box of how can we use the system a little bit differently and just continuously working to be better. And, I think our next piece is really how do we do a better job at utilizing transcription and AI more than we already have.
Yeah. Yeah. Well, Kaley and David, thank you so much for your thoughtful responses. Please stay with us a few more minutes. I think, Tim, if you could join us again and bring up any questions that came through.
Yeah, thanks, Ken. This has been great so far. We did have a couple questions here. I'm going to start, Kaley, sort of feed off of actually some of the things you've already just talked about here, but go a little deeper. Is that there's a question about provider experience. Can you expound a little bit upon, your provider's experience with athenaOne?
Sure. So when I think about what Athena practice looked like compared to athenaOne, it was almost one way to do it. I guess we had kind of two, but this is your only way that you're going to document and get to the end game of what you need for your visit. athenaOne has given a lot more flexibility for our physicians to be able to approach things in a way that makes sense to them. And so some of them really utilize text macros, where others are using encounter plans. Some are getting more confident in voice to text and dabbling a little bit more into the dictation. And so it allows them to do what works best for them personally, instead of saying, this is the way you have to do it. And so each of them are still getting to the same end game. The documentation's appropriate, but they're able to do that in a way that makes sense for them and still be able to focus on the patients there.
Yeah, it's quite a testament to what you said earlier that your docs, talk about athenaOne as a recruiting tool to new providers they're trying to recruit into the practice. That's
Right.
pretty powerful. So awesome. Thanks, Kaley. David, I have one for you here as well too. And I think especially considering as you talked about your background of, being involved in Chug and whatnot before. So you were looking to collaborate a lot, I know, back in the day too. So can you talk about how you view Athena as a partner and a collaborator?
Yeah, well, so I touched on it a little bit, right? Even with Carol and our CSM, really just helping us improve workflows, integrating data, I think, into every visit, right? Whether that's data that's coming from the hospital or coming from physician, their specialty offices, a lot of that clinical decision support that's laying through there. And I think ultimately, I touched on this right in the very beginning. I think the thing that, as I take a step back and look at, at this question, it's really our quality of care has just gone way up, right? We talked about this earlier, that when we hired that clinical quality director and just the amount of energy and effort and calories spent in that space, like our cares, it's just better having the data.
I'm curious just to add to that a little bit too, David. When you started the relationship with athenaOne, when you moved to athenaOne, did you really expect to get this level of partnership and collaboration at that time that you ended up getting?
Being a Quattros customer, we came from, man, we got tons of support from that space.
Yep.
And honestly, I was, like, oh, I got it pretty good because, they're 20 miles down the road and I know a lot of these folks, and, maybe I hope it stays as good. And really it's been phenomenal, just exceptional in that amount of data, and just having again, being a data guy, just having all of those tools at my disposal. And Kaley had mentioned it, right? These reports that just magically show up in my inbox daily, weekly, just to get to turn through some of that. It's really great.
Awesome. Thank you, David. Ken, there's one more question, and I think it's actually perfect for you, which is,
Sure.
Can you talk a little bit about how Athena communicates with customers about new features and functionality as they come available, and then how do we make sure that our customers are trained on those new features and functions?
Yeah, that's a great question, Tim. And in fact, we just had our spring release a few weeks ago in March. So athenahealth releases major updates 3 times a year on a very predictable triannual schedule. And at least 1 month prior to the release of new functionality, we publish a release center that provides a bunch of in-depth details and video guides and all that for all upcoming changes. And that's sortable by staff position affected by the changes or the product being updated, and by the level of change management or training that might be required for each update. For particularly big things that maybe require a little bit more change management, we had, for example, some scheduling changes recently. We send automated emails to the practice staff who have been listed as responsible for training to make sure that they're aware of some of the upcoming changes and the resources available. And in addition, to further support customers during releases, we hold release walkthrough webinars to highlight some of the key features that all of our clients are able to attend or watch on demand. And of course, our CSMs are providing training and user guides, which they can curate for their customers with some of the key features that they know their customers are going to want to adopt to share with staff or as part of their regular touch points. User groups are also going to be there to highlight and cover upcoming specialty specific changes and new functions. So that's a big part of it. And lastly, is one of my favorite parts about how we do releases is about 10 days prior to our release, our customers are able to begin testing key features in a preview environment. So they're able to ensure that they're comfortable with the changes or even make their own training videos for a more personalized approach to how they ready their practice, which is pretty neat. So, I think, Tim, we just have a few minutes left, and maybe if it's okay with you, I'd like to ask a final question to each of our panelists.
Please do.
My question, David and Kaley, is what is the best advice you can give other Athena practice customers as they consider making this change for their business? And Kaley, why don't you go first, and then David?
Yeah, I think there's a saying that the expert to be an expert in anything you once were a beginner. And I think take that mentality with whatever transition you make. Don't let good be the enemy of great, as I mentioned before, but be looking at ways to incrementally build upon the platform to make it better and better to suit your needs, and never stop learning and developing as you move forward. And I really think kind of secondary to that is keep a very open mind as you go through this entire process. The things that you've done for the past 5, 10, 20 years may not work in athenaOne, and that doesn't mean that that's necessarily a bad thing. I think we've been surprised in a lot of different ways at how making shifts like changing our appointment links have actually benefited us more in the long run. And so just really keep that open mind, give yourself grace, because again, you're starting something brand new and fresh, and it's going to take a moment for you to really get up to speed and understand the system fully. And again, never stop learning that either.
Yeah. And David?
I mean, I would say, I would encourage these folks to do a thorough assessment of your practice specific needs and your goals, and identify these areas that need improvement, and then equate that, understand how can athenaOne cover some of those challenges. This was how we did it when we walked through it, and when we looked at a couple of different EMRs, it was clear once we had some clarity around those goals, who could solve those goals. And then I think secondly is, and I talked about it a little bit, engage your stakeholders. You've got to involve your staff and your physicians and your admin folks. They've all got to be part of that decision-making process, because remember, if they can weigh in, they can buy in. And all of the people on your team, they have a very valuable perspective that would help make this transition way smoother, because they want to be a part of something that's going to be successful.
Yeah, I think very wise words. Thank you, David and Kaley, for your thoughtful responses. It was a real pleasure having you join us for today's panel discussion. Thanks again.